we were able to identify a higher incidence of traumatic brain injury in this population that has generally been reported. I don't think necessarily that that's because all of a sudden there are more traumatic brain injuries. I think that we just use a methodology and a population and a classification system that allows us to identify these cases reliably and accurately and report them. And as clinicians, certainly we've seen people with traumatic brain injuries of this kind for as long as I've been practicing. But as far as epidemiologically, what's reported in the literature, it's been tough to identify all of these cases. And using this methodology and this population base and this classification system, I think we've gone a long way to identifying the injuries that have probably always been occurring, just we haven't been able to identify reliably. Traumatic brain injury really is a spectrum of disease, and it affects individuals in all age groups. And it's important to be aware that so-called concussions are traumatic brain injuries, and they occur more commonly in sport-related events in younger people. But older people also have a high frequency of traumatic brain injury, and those are mostly related to falls. And if you really sort of look at it from a community-based education standpoint or even public health, 53% of these cases that we identified were the least severe. So if you want to try to prevent the most common kind of injury, you can focus on those mechanisms and those individuals that are more likely to be affected by those mechanisms of injury.